Flocking through the streets of the capital, Nairobi, healthcare workers stemming from those contracted under the Universal Health Coverage Program, clinical officers, pharmacologists, laboratory officers, medical engineers, alongside medical interns yet to be posted and those already posted, protested against what they termed as unfavorable terms of service. The health practitioners made way to the Ministry of Health headquarters, where they tabled their petition, making an unsuccessful attempt to reach the Health Cabinet Secretary Susanna Humincha.
In order to get universal health coverage, the only way you can get it is to get health workers. You can have infrastructure, you can have equipment, you can have drugs, but if you do not have health workers, all that will come to nil.
And they practice and they offer services to Kenyans. We have the interns who have stayed for a whole year, almost 1 year waiting for internship. And this is something that is not expected to be happening. We have written to the ministry, it has not answered us as to why. We have 2 cohorts who were used by the government during the COVID-19 scourge, and then they were dumped.
Health workers, when they qualify, need a year of internship. And that internship for health workers, particularly clinical officers and medical officers, is actually work. Some people want to think it is basically a training, but these people work. So they should be employed to do the work.
The demonstrations proceeded to arch the Parliament buildings, where a member of the Health Committee and Seme Member of Parliament James Nyikal pacified matters, receiving the draft petition, alongside Molo Member of Parliament Kuria Kimani, who also highlighted what they termed as a misplaced priority for the health sector in the country.
We do not have a problem with these people working, or if the government cannot put them on P&P on extending the contract. But what we are saying is that can we pay these people equally with how we are paying the other officers who are doing equivalent work? Equal pay for equal work.
That when health workers go to seek work outside, there seems to be a plan to restrict where they are going. How can you have people, you are not employing them, and you are refusing them to go where they can get employment? That is inhuman.
Unfortunately, you are being here is a reminder of the ugly incidents that happened during COVID-19. It is a reminder that billions of money that were allocated to help UHC, to help poor health workers, to help mitigate against COVID-19 did not go to where it's supposed to be.
Universal health coverage workers' contracts are scheduled to expire later in May, with a context over the terms of engagement after unions recently rejected an offer to extend their contracts under the same terms rather than the prior plan to permanently engage them.
We want the president to put his money where his mouth is. If he believes that health is essential, let him do it.
Declared universal health coverage as a policy. We cannot continue employing people on contract terms. It sounds like it is a pilot that we are testing that will end.
If they are not going to address what we have presented in the petition, then we are not here to test waters. We are here to make a statement that after 7 days or 14 days, we will be back here and we will call for the national strike. We are going to tell everybody in the health sector that Punda amechoka.
Tendencies of ensuring that healthcare workers are paid peanuts. These are people who have gone to school. So we are asking in no uncertain terms that our UHC staff, all of them, be absorbed into permanent and pensionable terms.
The practitioners have called for a quick action to address their petition that, among others, calls for permanent and pensionable terms and better pay, failure to which health services may grind to a halt in the country.
I feel that we are really oppressed as the UHC team, and we worked even under bad situations like COVID, but now the payment we are getting is not enough for us. So we are just requesting for permanent and pensionable terms.
Your petition is properly received, it is properly in order, and some of us that value professionalism will be there at the floor of the house to support this professionalism.
We have seen people who are deployed during COVID-19 emergency preparedness response team that were used and dumped. It is not fair. We want them to be recognized like the Ebola heroes and recruited or employed immediately.
So it should not be seen like these are our colleagues, we want them to. No, the jobs they are getting is basically to serve our people who need health care.
Under devolution, the health service delivery function was transferred to the county governments, while the national government retained policy and regulatory functions. Emmanuel Kutosi, Ebru TV.